Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. Today's lecture is supposed to be interesting because that is related with the child, the baby, and you know that the newborn babies, even up to the age of 2 years, 3 years, 5 years, they themselves cannot explain what they are getting the problem, especially in the many conditions the child is getting something like a pain. Vedana Adhyaya, this is the today's topic related with the newborn or the infants, where they themselves cannot express themselves about their pain or the restlessness or the irritation. What are the problems with that child? So for that matter, the Vaidya, the pediatrician, the doctor should understand a group of some specific symptoms related with that health problem of the child. We are talking today about the Kaumarbhritya tantra and very important topic, that is Vedana Adhyaya. But that particular symptoms also are very useful for the common man as well. So if anybody is having a not very specific student, they don't go. They just can wait and try to listen. Very interesting thing what the Ayurveda is talking about the children problem and the symptoms because of that problem. Okay, so let us start with the Vedana Adhyaya. As the Dr. Deshpande style, he is marking the specific topics to make a concentration. So this is why this chapter is very important from the Kashyap Samhita. Kashyap Samhita is a very good reference book to understand the children problem. Like we have the in Ayurveda, Charaka Samhita, Sushrita Samhita, Vagbhat, written by Vagbhat Ashtanga Hridaya. Similarly, for the children, the textbook is Kashyap Samhita. Kashyap is a name of Rishi, is a saint. Okay, so Vedana here in this chapter is not only pain, but in this chapter, Kashyap has explained a group of symptoms related with that disease. Group of symptoms related with that disease, and the pediatrician, doctor should know, or the even if you are the parents, you must know what can be the symptoms according to the particular disease. In this chapter, okay, Vedana means pain, but the child is not able to tell. See, here I am here, pain is here. The child cannot tell that he is having the pain in the ear. So what he will do? So crying and taking the hand near to the ear. Child is crying and taking the hands to near to the ear. That indicates that the child is having some problem in the ear. Another, the acting. Dr. Deshpande is a best actor also. He has got the best actor prize in the Purushottam Karandak Ekankika Spardha in Pune, intercollegiate competition. I have got the best actor prize. Just casual information. Suppose the child is having the headache, then he will do. He cannot tell by his mouth, doctor, please, I am having the migraine, I am having the headache. No. Unfortunately, the child cannot express. That is the importance of this chapter. Dr. Deshpande has explained two important things. One is about ear pain, another is about the headache. And all the time he will express by himself. Crying indicating something. The children, when they are crying, that may be the physical problem, that may be psychological problem, that may be emotional problem. Try to understand. But we must find out what is the reason of crying. Some in our practice, we have seen some cases that in the cradle, where the child has been kept, at the bottom of it, some small needle. Oh my God, sir, how it is possible, the needle? The mother or the relative has some sieving here and there, and by chance they drop that needle, small needle, and they find out here and there, but they could not find. And the child inside starts crying. But when you take one piece from the another, from the cradle, the clothes and everything which is kept in the cradle, and one time when you make this shaking of that, for example, bed sheet and all these things, and oh my God, the needle has fallen down. So that needle was pricking to the child, and child was crying in the cradle. Most practical examination I have given, ear pain, head pain, and the child having the pain, cry. Sometimes the child is having constipation, gas in the stomach, and he cannot tell you that I am having constipation, I am having gas, and they start crying. And only restless, arati, aswasthata is the very important for this Vedana. So, in short, I would like to tell you, Vedana is really pain. But pain is not really what you say. Oh, doctor, pinching. It's pain is, of course, I understand. But these pains can having the discomfort. Please write down this word. In this chapter, in this Vedana Adhyaya, Kashyap has indicated the different group of symptoms which indicating some specific disease. Vedana is not only pain. Here, the discomfort is most proper word. Discomfort. A group of signs and symptoms, they indicating a specific disease, explaining the discomfort with the child. So let us see. Vedana, knowledge of the signs and symptoms with the nearly 32, 35 important things are mentioned in this chapter. Vedana, they describe the clinical manifestation of various diseases in the children. Vruddha Jivaka, this is the disciple, Shishya, asked the Guru Kashyapa. Kashyapa is a teacher, and Vruddha Jivaka is the name of his student. He has asked about the method of diagnosis in the children. Doctor, hey Gurudev, Kashyap, how we can diagnose the different things in such a small child? He cannot speak, he cannot explain what to do. The student is asking to the teacher Kashyapa, because most of the things the child is unable to explain the complaints adequately. So Kashyap has explained the answer, very comprehension, very in a nutshell, very important features. All the clinical features mentioned under this heading are like the short case that you student are taking in the hospital. This is like a long case and short case. These are the short cases. That is spot diagnosis. Kashyap has given the symptoms. Kashyap has given the symptoms which can make spot diagnosis, immediate diagnosis. Write down this word, spot diagnosis, immediate diagnosis. SPOT, spot diagnosis, immediate diagnosis. If you remember this group of symptoms, you can make immediate diagnosis. And that is require minimum clinical examination and interaction with the informal. There is no need to go the long case. What is your name? What is your address? Let me check you the darshana, sparshana, prashna. Palpation, percussion, auscultation, interrogation, histotic. No. Only 5 symptoms, 5 clinical features, diagnose. 5 clinical features, diagnose. 5 clinical features, diagnose. Why you are so aggressive? Because I want to tell you the fact. Only you have to remember, very, very important. Now, when I will go further, there are a lot of Sanskrit words on the left side. I am not going to bother you. Your head will be like this. If I start pronouncing very important Sanskrit words, I will take. But most of the time, you try to understand the English translation of that symptoms. Okay, let us move. Total 34 clinical conditions here. Can you see my cursor here? Cursor moving. Have been enlisted. How many? Please write down the number. 34. 34 conditions for diagnosis. Spot diagnosis of 34 conditions explained in Kashyap Samhita. The name of the chapter, Vedana Adhyaya. Most of the signs and symptoms mentioned are prodromal, like a purur, warning. Prodromal, purvarupa, warning symptoms, warning signs. So it is also called as a diagnosis based on the clinical feature of the disease. Reference Kashyap Samhita Sutrasthan, chapter number 25. Please write down. Kashyap Samhita Sutrasthan, chapter number 25. Let us start to discuss 34. 34, please understand. 34, number is important. First, headache. Headache. Huh? Kashyap Samhita Sutrasthan, chapter 25. Only you remember this thing. Forget about shlok. Now, what the child will do? Roll his head like that. Roll his head. Headache is there. Roll his head. Close his eyes. You do the practical by yourself. Closing the eyes. Then avakujeti, moaning. Why I am doing this? To understand you more. Moaning, restlessness, not sleeping properly and moving here and there, and insomnia. He will not sleep. Otherwise, the child is sleeping at night, say for 8 hours, in the daytime also, say 4 or 5 hours. But this child will not sleep. He can't sleep. He can't sleep. You can understand by yourself. You are a student. I am asking you, viewer. If you are having severe headache, can you sleep? Severe headache is there, and you are not taking any Combiflam, Voveron, paracetamol, nothing. Dolo. No. There is headache. What you will do? Can you sleep? No, not at all. Not at all. You will take some cloth and tie over here and some Amrutanjan and Vicks and everything you will rub and try to get relief. So only concentrate on the symptoms. We are not talking about management. How the children headache can be diagnosed? By these 5 symptoms. He is rolling his head, number one. Number one, closing his eyes, chakshu nimilina, because he cannot tolerate the light. You know the prakash asahatva. Whenever the migraine attack is there, in the adult also, in the adult, you inquire your relatives, father, mother, uncle. When they have the migraine attack, they go to the room, close the door, put the lights off, put the TV off, everything, and take the cloth and tie it over here and just want to close their eyes. That's it. Actually, they don't get the sleep, but they want quiet and calm. No light. Photophobia is there. That is why. And moaning will be there. Next. Karnakshveda. Can you see here? Next. That is ear pain. Again, touch the ear frequently with the hand. Shakes the head. Like this. Restless. Anorexia. The child will not take the breast milk. Basically, this is related with the first baby, 6 months, 1 year. The child will not drink. If you try to feed him, no feeding. He will not accept the food. And insomnia. Anywhere when there is a pain, the person can sleep? No, not at all. So this anidra, aswapana, Sanskrit word is aswapana. They will continue for the many hours. Next. Diseases of the mouth. Diseases of the mouth. Okay. So mouth, salivary glands. So excessive salivation will be there. Then child do not want to take the sucking of the breast milk. No, not possible. Restlessness will be everywhere. Arati, this lakshan will be the nearly most common in all 34. All 34. Remember the word 34. And remember the organ relation. Which is the organ? Here, mukhamanya, diseases of the mouth. Ejects the ingested milk. Naturally, he will not try to keep the milk or drink the milk. He will vomit it out. And nasal breathing. Nasal breathing will be there. Okay. But the first 4 are more important. Next, Kantha Vedana, throat pain. Vedana is there, Kantha Vedana. Here, pharyngeal problem. Inflammation may be there. We don't know. Child will have some pain inside in the pharynx, throat. And then what he will do? Again, anorexia. He will not want to eat anything. Because there will be pain when he will start drinking or eating something, ejects, vomiting will be there. Okay, and glani, because that is most probably infection. Infection in the throat. Please write down this word. It is not given by Kashyap. I am telling you. Whenever there is a throat pain like a pharyngitis, there must be some infection. And that is why there is fever, mild fever, jwara is there. Then glani, drowsiness will be there. Because fever, always in the fever, the patient loses the energy. Glani, drooping the drowsiness. He is not actually sleeping, but he don't want to do anything. This is glani. Okay, so throat pain may be because of the infection. Please write down this word which is not here in front of you. Because whenever there is a fever, my comment is not Kashyap. My comment, Deshpande sir's comment by experience. Whenever there is a fever, there are chances of infection. It may be viral infection, it may be bacterial infection, whatsoever, but infection must be there related with that organ. Are you getting? Next, fifth one. Adhijivika. Can you see fifth one? Epiglottis. Epiglottis problem, adhijivika. So again, it's a part of your mouth. So naturally, whenever mouth, saliva will be there. Again, anorexia will be there. Again, glani will be there. Swelling and pain at the cheek region here, outside, and have the open mouth. Because it is paining inside. But the first three are more important: lalastrava, aruchi, and glani. Whether it is a mouth, epiglottis is related with something with the mouth, because it is a covering to that laryngeal part. Whenever you are eating something, it is covering that larynx, and you cannot have the problem in the respiratory, because otherwise the food particles will go into the respiratory tract. So that is the adhijivika or the epiglottis type of the problems. Next, galagraha. Again, the throat problem. Can you see? Gala means throat. Previously it was kantha, but nearly same, galagraha. But here again infection is there. Jwara, aruchi. The patient do not want, the child do not want, baby do not want to eat anything or drink the breast milk. Mukhastrava and moaning. Moaning is same. Like, can you understand? This type of paining is called a moaning. Marathi मध्ये आम्ही त्याला in Marathi language we kanna, discomfort, restlessness, discomfort, restless. These words should be common everywhere. Whenever you write the question on this Vedana, don't forget to write down the arati, restlessness, discomfort, and other symptoms will be according to the organ. Whenever you are suspecting infection, you should write down jwara. Okay, and everywhere there is a, according to the organ, the symptoms will vary. Now, again, many things are related with the mukha and kantha. First, kantha shotha, pharyngitis. Here I have written this word. So, is there like a sore throat, itching in the kantha? But the child will not be able to tell you. Child will not be able to tell you. But swelling will be there when you examine that. But fever indicates infection. Then anorexia, child is not taking anything, food or the breast milk, and there will be also headache. Okay, so these are the symptoms of kantha shotha. Next, whenever you try to understand, whenever there is anorexia, it is a problem in this part, or it's a problem of the infection. Because of the jwara also, we lost our appetite. Okay, purva rupa of the jwara. How you can understand that the child is going to get a high fever? Number one, frequent flexing of the limbs. Frequent flexing of the limbs. Frequent yawning will be there. Cough will be there. Sudden grip, the wet nurse. She will try to grab, to take the support. Dhatri muliyat. And does not like normally to take the feeding. In all the most of the symptoms, the child do not want to take anything. So this indicates yawning, flexion of the limbs, coughing. This indicates the child may get the upper respiratory tract infection and fever will be there. Okay. Pururupa jvara, prodromal feature of the jvara. Here you can see muhur namayate angani, jrumbate kasate muhu, dhatri muliyate akasmat, stanam na ati abhinandati. Do not like. Abhinandati, do not like. Next, we will go further. Now we are going to the lower part of your body, that is stomach and intestine, that is atisara. Loose motions, loose emotions. Okay. Again, you can see restlessness everywhere. Arati is very common in 34. Anywhere you can write down Arati. Don't bother. Because although Kashyap has not mentioned, I am telling you that Arati is a common feature whenever there is a discomfort, whenever there is a Vedana in the body. Arati, aswastha, restlessness. Then excessive sleep will be there because of the dehydration. You can write down dehydration. Then suppress the normal function of the Vata dosha. So normal activity will not be there. Child will not be happy. Child will not laugh. Child will not be joyful. That is the suppression of the normal function of the. Then why the discoloration? Because maybe acidosis, cyanotic symptoms may be there. Because of the dehydration, some electrolyte imbalance may be taking place. Some oxygenation will not be proper and there will be discoloration. Pale color will be there. Because there may be hypovolemic shock. Because loose motions are going to start. Okay. But some symptoms we cannot very. Here you can see mukha glani. This is the symptom of dehydration. Mukha glani. Glani is a drowsiness. Glani is a drowsiness because of the dehydration. Next. This is the most important. Udara shula. Intestinal colic is very common in the children. Because the child, when it is not properly fed breast milk, it gets the gas in the stomach. And that starts the paining. So always, every after the feeding, the mother has to take the child on her shoulder and pat from the back, patting from the back or moving the hand on the back like this. This is my child. You can consider this is child and we have to move this hand like that. After feeding, I am telling you after feeding. This is child. This is child. I am mother and I am moving this my hand. So actions are more important to remember the thing. That is Udarashul. What is that? Sthanam vyudarasyate roti cha atanaha cha vibhajyate udarastabdata shaityam sukha svedascha shulinaha. Let us see the meaning. First is a sthanam vyudasyat. Refuses to take the breast milk. Very natural. Rauti. Child will start crying. Then chautanashche vibhajyate. Sleep or lies in the supine position. Okay. Udarastambhata, sabdata, stiffness of the abdomen. If the doctor is palpating, he can feel the palpation. Udarastabdata, feels cold. Whenever there is extreme pain anywhere, there is the action of what you can understand. Sympathetic system is activated. Sympathetic system. And because of that, there may be vasoconstriction, blood supply will be less, and the extremities feel cold. Then sweating will be there. Again, this is indicating of sympathetic stimulation because of the pain. Sympathetic stimulation because of the pain. Dr. Deshpande is mentioning about these explanation about why the extremities are cold, because circulation is hampered, and sweating because of the excessive sympathetic stimulation. 11th problem is chardi. Can you see vomiting? So what will be there? Number one, simple. When there is vomiting, you will get the lakshan vomiting naturally in chardi. So at least common sense you should use. Then there is a, what you can say, the repeated eructation. Udgar will be there. Excessive sleeping because of the dehydration. Because of the dehydration. That there will not be energy in the child and he will sleepy, drowsy. Yawning will be there. Yawning will be there. Okay. Next, Shwasa. Don't bother about too much. This is a indicating chapter. Is not a very specific chapter, but just indicating some important things to you. Shwasa, that is a breathlessness, dyspnea, hot breath from the chest, exhales hot and noisy breath from the chest. That indicates, like for example, today we don't have any much problem. We don't have any much problem. I will tell you one interesting thing which is not there, but I can tell you. With the understanding of the modern knowledge, you can also write down in your examination, you can answer in the viva. When there is a pneumonitic condition, pneumonia is a lung parenchymal disease because of the infection. So one part, half lung, full lung, two-third, whatever, pneumonic patch is there. When you do the X-ray, you will get the white patch, pneumonia, white patch. And the child is very breathless in the pneumonia. High fever is there. I don't know why they have not mentioned. But it may not be infective condition, shwas, breathlessness. So in the I'm telling you pneumonia, write down this flaring of this nasal alai nasi, alai, alai, this alai nasi will move. This will move in the baby. This will move in the baby. It indicates that the child is breathless. More modern pediatricians, they explain like this. This part is called as LI, A-L-A-I, nasi or nasal, N-A-S-A-L. This flaring movement of this LI nasa indicates there may be possibility of pneumonia. But we don't have an outdated problem. We don't have problem. We have the instrument stethoscope. So immediately you apply the stethoscope and see whether there is a Vataja dhvani or Kafaja dhvani. Vataja dhvani can be called as a Ras and Vataja dhvani is a Ronkai, Shishka, Ronkai. And Kafaja dhvani are called as Ras, R-A-L-E-S, like a crepitations, crepitation. Okay, so that you can get the noisy breath from the chest. That is nothing but the wheezing sound. Please write down this word, very important. Wheezing sound or crepitations. Okay, next. Hicca, 13. Hiccup. Hiccup. Akasmat maruto udgaraha. Sudden airy erected, like this is hicca. It is often seen in the emaciated children. Very interesting. Because this is a Vataja problem. And Vata Prakop, whenever there is a Dhatu Kshayjanya Vata Prakop, emaciation, weight loss, marasmus, kwashiorkor, this is the common that hicca will start. Next is a Trishna, that is excessive thirst, which is also called as a polydipsia, D-Y-P-S-R-A, poly, P-O-L-Y, dipsia, D-Y-P-S-R-A, polydipsia, excessive thirst. If the, just out of curiosity, not 1 minute Kashyap side, I am speaking another. 4 P's, 4P or 3 P's are there in adult diabetes mellitus. Just out of interest, diabetes mellitus, polyuria, excessive urine, polydipsia, because output is more thirst, and polyphagia, excessive hunger. 3 P's for diabetes mellitus. Now, out, Kashyap in. Okay, so here you can see, nacha trupyanti, child will not get satisfied in spite of having excessive matru dugdha, that is tanya. He will always crying because he is not satisfied. Breast milk contains maximum amount of the water, and the child is having the excessive trishna, thirst, so he is not satisfied. He will start continuous crying. Dry lips, palate, and eager to take water, and very weak, that is dehydration. Please write down dehydration in Trishna. Trishna indicates dehydration. Please write down Trishna indicates dehydration. So how to identify dry lips? Concentrate what Deshpande is telling. Dry lips. Look here. Look here. Child will do this all the time. Child will do this all the time. Child will move his tongue on the lips. Look here, look. Child will move his tongue. You can write this. You can write this in the exam. You can tell in the examination. This indicates that the baby's lips are dry. Action. Very interesting. Next. Anaha. Again, abdomen. Anaha. Fullness of the abdomen with gas. What will happen? I have mentioned only the important thing, dullness. Because the child will be restless, again arati, and he will not play, he will not demand for the food. Exhaustion. He will start moaning because gas. Although it is not mentioned, I am telling you, you can write down. Okay? So, wide open eyes, he cannot sleep properly. There may be arthralgia, so he will move his legs all the time, move his hands, move his legs. It indicates that he is getting pain in the limbs. Okay? But that origin is in the stomach, indigestion, anaha, atop. Okay? Retention of the urine and feces. You have to ask the parents whether the baby is passing urine, baby is having the stools or not. Check the diaper. Now these are the days of the diaper. So you have to check the diaper. But I don't know whether you can get the indication of the urine and stool. But yes, because there is a problem in passing the urine and stool, the child is getting anaha. Next. Out of 34, we have to rush for 34. Only 16 now. We are in the number 16. We have to go for 3-4. Apasmar is epilepsy and unmad is like hysteria. Apasmar is basically physical problem in the brain. Electrical circuit is not proper. And unmad is not physical. Some tensions in the mind. Yes. Baby may have some stress. He is not looking the mother all round for last 3 hours. So what he will do? He will having type of the mental discomfort. That is unmad. So unmad is psychological. Apasmar is physical. Epilepsy and hysteria. So sudden loud laughing. The child will, without any reason, nobody is around. Why is laughing? That is supposed to be producing either this type of attacks, convulsive attacks, either apasmar or the unmad. Pralap, delirium, dullness, instability of the mind. Sometimes the child will laugh. Sometimes the child will cry. Sometimes he will start talking, something like that. So he will start like a pralap, a delirium, and dullness will be there. So this indicates the child may starts convulsions because of the epilepsy or the hysteria. Next is the problem of urine. Mutra krichra. Dysuria. Painful micturition. Here, can you see? Mutra kalecha vedana. Only important things you remember. Don't go for all symptoms. It's not possible. It's not possible. So, mutra krichha, painful micturition, biting of lips. You just imagine, even the adult person, he is having the prostate problem and he is not passing the urine. Sometimes looks to the face of the adult person, prostate. Giving the pressure on the urethra to pass the urine. So similarly, biting of lips, indicating the baby is giving or wants to give the pressure for something, okay? Touches the area of the urinary bladder. Always baby will try to touch the genitalia, urethra, penis, vagina, vulva. the female child will do. But genital, touching of the genital, indicating that genital, excretory system, genitalia, genitals have some problem. That much you must understand. Where the baby is touching to that part is having some inflammation, maybe some सूजन है और भी कुछ स्ट्रक्चरल डिफॉर्मिटी है, फंक्शनल डिफॉर्मिटी है, ऑब्स्ट्रक्शन है, कुछ ना कुछ तो इंडिकेट कर रहा है. जब बेबी जेनेटल्स को टच कर रहा है तो इसका इंडिकेशन है. वो हेड को टच कर रहा है तो उसका इंडिकेशन है हेड का कुछ प्रॉब्लम है. ईयर को टच कर रहा है, ईयर प्रॉब्लम है. नोज को टच कर रहा है, नोज प्रॉब्लम है. मूविंग द टंग ऑन द लिप्स, लिप का कुछ प्रॉब्लम है. लिप डिहाइड्रेशन में भी ओरिजिनेटेड फ्रॉम द अतिसार. सो दिस टाइप ऑफ द थिंकिंग प्रोसेस, when the student will write in the examination or give the oral, he should have the logical thinking of all this scenario, and then he can answer very easily. Don't bother, don't take tension. So I am not remembering that horripilation. Forget. Romaharsha. Roma. Any pain is always giving your Romaharsha, horripilation. Standing your hair on the body. So that is the indication of pain, severe pain or the fear. Fear also can create the same thing. Angharsha, shivering of the body parts. Whenever there is a severe pain, always body gets shaken. Okay. Next is a prameha. Prakarshena mehati iti prameha is not only diabetes mellitus. Yes, it is diabetes, but madhumeha is specific. But any type of the urinary problems. For example, here they have mentioned the dullness, then sudden excretion of the urine, then liked by the flies. This is the most important feature. Please remember, this is the most important. Makshika krant. Even in the adult, when the adult person having the diabetes going to the toilet, Indian toilet I am saying, not that particular Western type of the toilets, but when it is some spots are shaded outside and it is not properly drained by the water, is not cleaned by the water, that remaining drops, immediately after some time you will see that the ants are there, because that urine contains the sugar. So at that time, Charak's time, Kashyap's time, they were knowing that particular diabetes patient is having the urine with sugar, glycosuria. So that sweetness attract the ants. Makshika kranta. This word is the most important word. In the oral, some examiner will ask, where is this lakshana, makshika kranta? In Vedana Adhyaya, in Kashyap, where this symptom has mentioned, because this is specific. Arati is not specific. Arati will be for every 34. Anidra for every 34, no problem. Not taking the breast milk, maybe many times. But Makshika Kranta only in prameha. So you have to try to find out the symptoms which is very specific for that thing. So this is, you can see, Makshika Kranta. Then the child will be dull because there will be not energy. Because again you try to understand, in the diabetes, in the prameha, in the madhumeha, sugar is in the urine, but sugar is also in the blood, but sugar is not in the cell. Sugar is not in the cell. And that's why all the body cells, body tissues, body organs, they are having less sugar. And without sugar, without carbohydrate, how one can get energy? Tell me how one can get energy. That is why dullness is there. So some symptoms are very specific. Okay, let us move further. Arsha, hemorrhoid, dilated veins near the rectal region. Piles, P-I-L-E-S, hemorrhoid, H-A-E-M-O-R-R, hemorrhoids. This is another synonym, paryay now. What is that? See, passes the stool with the blood. Stool with the blood. When PR bleeding is there, this is new understanding. For a few moments, Kashyap side, Kashyap on the side. Here, another aspect. PR bleeding. Tell me the 3 important reasons for PR bleeding. Only 3. Per rectal bleeding. Number 1, please write down. Fissure. Fissure in ano. Fissure. Fissure in ano. Around that anal opening, small scratches, wounds. Fissure in ano. Very painful, very painful. This is one of the reason of the bleeding. Number two, this piles, hemorrhoids. Second reason for PR bleeding. Third reason for PR bleeding, write down. Fistula in ano. Fistula, F-I-S-T-U-L-A. Fistula in ano, Bhagandar in Ayurveda. Bhagandar in Ayurveda. Ayurvedic names for PR bleeding, 3 names. Parikartika, Arsha, and Bhagandara. Parikartika, Arsha, Bhagandara. Fissure in ano, piles, and fistula in ano. These are the 3 important causes of PR bleeding. Back to Kashyap. Come on, back to Kashyap. Okay, stool with blood. There may be itching at the anal region. There may be pricking pain at the anal region. These 3 important I would like to tell you. Okay, next. Renal calculus, point number 20. We have to go for 3, 4. Huh? Come on. 20. Ashmari is a renal calculi. So first, presence of gravel in the urine, that is Sharkara, small like a sand in the urine. Crystalluria, crystals are there. When you examine the urine routine in the laboratory, in the microscopic examination, there are different parts like pus cells, RBCs, cast, crystals, epithelial cells. Am I right? So here the crystals will be seen, much abundant crystals, indicating calculus. Okay. Atimutratvam, yes, irritation is there. Excessive micturition, urination will be there. Vedanam, oh my God, very important. Painful urination. Prathamam rodati, continuous crying. Kshama, weakness will be there. After too much crying, the child will be exhausted. Okay, next, 21. Skin problem. Visarpa, 21. Red patches will be there. Visarpa is always red patches. Burning will be there. Pitta dosh is there. Pitta dosh and Rakta Dhatu, and fever will be there. I have marked only important symptoms, and you also remember first only important symptoms. Not necessary that mother all, learn all, याद करना है पूरा का पूरा सब कैसे हो जाएगा. अरे नहीं टेंशन लेने का भाई, नहीं लेने का टेंशन, काय को लेने का. हम तो लॉजिकली सोच सकते हैं ना क्या होता है, कौन सा अवयव है, क्या प्रॉब्लम है. तो काय काश्यप जो है ना, उन्होंने भी जो कॉमन है वही लिखा है ना. का टेंशन काय को लेने का, ऐसे कुछ डिफिकल्ट चीज नहीं है. ध्यान रखने वाला सिम्टम्स. ठीक है, तो ये देखिए विसर्प में क्या देखेंगे आप. स्किन प्रॉब्लम पहले तो लिख दो, त्वचा का प्रॉब्लम है तो रेड पैचेस यहाँ यहाँ वहां हो जाएंगे, बच्चे के ऊपर, पीठ के ऊपर, एब्डोमेन के ऊपर. ठीक है, बाद में क्या हो जाएगा, बर्निंग है और फीवर है. मैं बोल रहा हूँ पित्त वाला प्रॉब्लम है तो लिख दो पित्त वाला प्रॉब्लम. पित्त है तो थर्स्ट हो जाएगा. ज्यादा पित्त प्रकोप से यू विल हैव द मोर थर्स्ट इन द पित्त प्रकोप. 22nd, my dear friends, Visuchika. But you have to remember these names. Visuchika. Suchivat Vedana, picking sensation. Pricking, write down. Visuchika. Suchi, needle. Suchi, needle. Visuchika. Patient is getting like a pain, pricking pain in the abdomen because cholera is there, gastroenteritis, food poisoning, vomiting as well as diarrhea. Vomiting, loose motions. Okay, can you see here? Burning sensation all over the body because of the dehydration, pricking sensation, then difficult respiration because dehydration is there, metabolic acidosis will occur and breathlessness will start. Okay, so these are the important features, but basically there will be also loose motion. Don't forget that. Next, alasaka. That means your food is not properly digested and it is not moving properly. That is alasaka. Is like a laziness. Alas in Marathi. Unable to hold head in a proper position. Repeated yawning does not suck the breast for longer time. Vomiting will be there and anorexia will be there. Forget about dysgranthi. I do not agree with this because at the moment it's like a tumor in the stomach. It's like a tumor, small tumor may be there. But this is related with your abdomen, first thing. This is related with your indigestion. So unable to hold the head in proper position. It is something like a maybe severe abdominal pain and there like a whole body is little bit in a unstable condition. So, but this symptom is not too much important. Repeated yawning, it's okay. Does not suck the breast, very common, and vomiting, very common, very common. Okay, and anorexia will be there. Now, 24th, we have to go for 34. Huh? Chakshura Amaya. Can you see? Sorry. Chakshu means eye. And Amaya, can you see Amaya? Amaya is always disease. Difficult in looking. Then inflammation around the eyes, pain in the eyes, redness in the eyes get surrounded with a thick discharge during the sleep. I think it's a very common complaint of conjunctivitis. Modern conjunctivitis having the same thing. Photophobia. Difficulty in looking means the child will close eyes when there is a light. Inflammation we can see, doctor can see, relatives can see, pain will be there. So the child will look like, can you see? Simple things you remember. So Chakshuramaya, pain, redness, eyes get the discharge. Next, Kandu, Ardra or Shishka, because of the skin problem. This is again skin problem. Itching will be there. Either it may be because of the dry skin or maybe because of the clay or the wet skin. So here you can see when there is a shushka, itching, what the child will do, baby will do. Scratching, always weeping, rodati, and desire for rubbing. So always like this, always us moving like this. Baby is doing all these things, not Dr. Deshpande. Then whenever there is a ardra, then you can see the gets pleasure with rubbing, again the same thing, pain will be there and burning will be there. Okay, so restlessness is a common complaint. 17th and 28th, that is related with the Pandu and Kamala, the disease of the Pitta again. You know everything. Pandu is an anemic condition, so pallor is very clear. Pale conjunctiva, always we check the anemia in the adult also. Can you see here? Yes, this is red. Are you clear? This is red, this is not pale. So if it is pale, that indicates the anemic condition. Hemoglobin is less than 10 gram %. Okay. Then swelling around the umbilicus, pale conjunctiva. This is the most important. Deformity of the nails. Yes. Fantastic. Salute to the Kashyap. Please, you also make salute to the Kashyap. Because today also, anemic patient, they have described, normally it is convex. Come on, look your own finger. Check your own. It should be normally convex. But in the anemic condition, it becomes the concave. Spoon-shaped nails. Please write down. Spoon-shaped nails. Concave nails. One difficult and interesting word I am telling you. If you remember, that is your luck. You will get the merit marks. So what is that name? So tell us. Koilonychia. Oh my God. So what is that? Koilonychia. No, I am not telling details. K-O-I. Write down. K-O-I. Koily, L-Y. Nychia, N-Y-C-H-I. So difficult, no? Yes, I know. But it creates the impression. Koilonychia. Spoon-shaped nails. Koilonychia. Spoon-shaped nails. Koilonychia anemia. One more. Flat nails, flat. Concave, no concave, flat. Interesting word. Come on. Platynychia, flat nails, anemia. Platynychia, flat nails, anemia. So very interesting, your teaching style. Koilonychia, platynychia. This is, see, salute. Make first salute. Kashyap, Samhita, salute. Because he has mentioned Nakhavakrata. Nakhavakrata. Enough, no? Yes, okay. Agnisad, loss of appetite. Akshikut, periorbital swelling. Here, periorbital swelling. Very interesting. But this is more common. More, of course, it can be in anemia, but more common in the, yes, kidney disease. So whenever there is a CKD, chronic kidney disease, and erythropoietin is the local hormone secreted by the kidney is less, erythropoiesis is problem. Blood will not be properly formed, RBC is not formed. So whenever anemia is because of chronic kidney disease, anemia because of CKD, chronic kidney disease, then periorbital swelling here. Again, Akshikuta Shvetu, select, Kashyap Samhita, select. Why? At that time, he has mentioned that anemia may be because of the chronic kidney problem. And this is not given anywhere, only in the Deshpande's class, because of the experience and the understanding, proper understanding of Ayurveda and modern. Next, Kamala, yellowish discoloration, Pitavarna of the specifically eyes, urine, this you know, jaundice, infective hepatitis. You write down all these symptoms. Anorexia is most important. Next, arm. We are now in the 30th. Whenever there is a toxin, endotoxin, because of the indigestion, what can happen? First is the anorexia, then excessive sleep. The patient will be always drowsy, no energy, because indigestion is there. Then also dullness is there, aversion of food will be there. That is arm. This is something interesting. Yes. Confusion. When learning Vedana Adhyaya in the colleges with the teacher, with the children, with the friends, always, shit, I don't agree, Kashyap is right. Because they were knowing, the students are knowing, teacher is knowing, Madhatyaya, it is related with the alcohol, alcoholic intoxication. So what that Kashyap is, how he is written, sir? You are saying salute. We don't salute him, sir. How he can write? The baby can drink the alcohol. Is it possible, sir? Baby can drink alcohol? Check. I don't like it. Kashyap Samhita. My dear viewers, my dear students, please try to understand these great people. Charaka, Sushruta, Vagbhata, Kashyapa, Madhavanidana, Yogaratnakara. They are super human being, great and intelligent people. Don't insult them. Please try to understand, reading in between the lines. This is indicating something to the pregnant woman. If during the pregnancy, if the mother is taking some alcohol, if mother is smoking, if mother is having some medication which can give the hypnotic or tranquilizer, the tablets for the insomnia, sedative drugs, pregnant lady, the mother of the child is taking something like this, narcotics, alcohol, smoking, then the effect may be on the child. Please try to understand. And that is why he has explained this word. Okay? So don't blame to the Kashyapa, don't blame to the Charaka Samhita. Our understanding may be little bit less. It will take some time. I am not the only person. So many people are trying to understanding what the Charak Vagbhata Kashyapa are saying. So we should not disregard to these great Rishi Munis. Okay. So here they have mentioned the child may suffer from insomnia, vomiting, aversion of food, and giddiness. If the this is a part of research. That's why I have made the question mark. Question mark is not for understanding. Question mark is a confusion in the mind of the students and the teachers. And there is a need of the research. There is a need of the research. Next. 31, 32. Chardi and Uroghat. Whenever there is a trauma to the chest, Uroghat, and there is a Chardi. So both these problems, breathing from the mouth because the child is little bit dyspneic. So not only the nasal breathing is sufficient, he will open the mouth. Running of the nose may be there. Always touches the orifices. Here, always touches the orifices. Sneezing will be there and coughing will be there. Whenever there is a chest trauma, then all these things can happen. Next is the insect bite. This is also very common. Very, very common. Very common. Simple mosquito bite. The child does not sleep well at night. Good night. So you have to put the button of the good night. Then Jantu Karditam will not be there. So interesting word. I like this word. Jantu Karditam. These some simple words you must remember because the examiner is always tricky. Huh? He want to trap the child, trap the student. So he asked whether you know, have you read the Kashyap Samhita? Huh? You know Jantu Karditam क्या होता है? पता है आपको जंतु कर्दितम? इसे सर ऐसा कुछ होता है कृमि वगैरह सर पेट में का जंत हो जाते हैं ना तो उसको जंत बोलते हैं सर. अरे नहीं भैया, जंतु कर्दितम अलग है. तो उसका इंसेक्ट बाइट ये शब्द आपको ध्यान में रखना पड़ेगा. ओके. नेक्स्ट, red dots over the body parts. Where it has a sting, mosquito bite, there will be red dots. 34th is a simple Graha Rog that we have already discussed a lot. In the videos are available, Dr. Deshpande's video. You go and see the Graha Rogas. Okay. Samanya Lakshanas of Graha Roga, you can see that. Next is the Samanya Chikitsa Siddhanta for this management. What you can do? What you can do, doctor? What the doctors can do? Understanding the disease of the child. First, diagnosis should be proper and application of therapeutics. Okay. So clinical presentation of the disease in the children is a different, and you have to take care. Logical thinking, your brain should work more fast. Application of the therapeutics, that you have to the final aim to make the Vata, Pitta, Kapha balance. Here you can use the Daiva Vyapashraya Chikitsa, Yukti Vyapashraya Chikitsa. What is that Daiva Vyapashraya Chikitsa? Can you see here? Just the last part of the lecture, so just relax, few only minutes. Daiva Vyapashraya, some diseases can be eradicated by Om Namah Shivaya, Om Ganeshaya Namah. This type of mantras. Om Bhurva Swaha Tat Saviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Nah Prachodayat. Surya mantra. Lot of mantras are there. Then Yajna, then Homa. This can be done. Then Manovyadhi, especially Unmada and Apasmara, there Daiva Vyapashraya Chikitsa is more important. Counseling to the patient is also a part of. Ashwasana Chikitsa is also a part. Swasti Pranidhana. Some different words you must remember. Yukti Vyapashraya, logical brain thinking. Dravya Bhuta and Adravya Bhuta. Dravya Bhuta is a direct giving some medication. And Adravya Bhuta, like giving Dipana Chikitsa or the fasting or giving the blankets when there is a shivering. So this is a Adravya, giving some warm fermentation whenever there is a shivering. So this type of the measures taking from outside application. So Adravya Bhuta Chikitsa is without any medicine. So my dear friends, in this interesting lecture of Vedana Adhyaya, Professor Dr. Deshpande has many times acted, and that's why this topic may be interesting for the students. So I request to show the actions of Dr. Deshpande. At least you share this video. Maybe some students are, oh, Dr. Deshpande is too funny, yeah, too funny. I don't agree this type of teaching. Anyway, this is your lookout. So some students like it, some students don't like it, but I like to teach. That's why I make this type of explanations. So I wish all the best. Take care and see you soon for the next lectures. Take care and don't forget to subscribe my YouTube channel. Thank you.